She's a vice president of IDEC, and she is a wonderful dietitian. Over to you, Shilpa, for the wonderful talk you're going to give on gluten-free diets.
Thank you so much, Dharini ma'am. And okay, so I'm going to be speaking about gluten-free diets. What is the evidence of its benefits? And just giving a slight bit of historical perspective, gluten-free diets actually hit the center stage around 1990 and actually changed the food culture around, because we realized that gluten is very rampant in what we eat. And there was always interest with gluten-free diets as far as celiac disease were concerned, but there was also a resurgence of interest in other gluten-related disorder. Now, there is some evidence to suggest that gluten and other wheat proteins play an important role in triggering symptoms in individuals without CD. The grains that actually contain gluten seem to have potential of antigenicity, which is actually not related to gluten itself, but it is related to other proteins and additives which are present. Few scientists have suggested that alpha amylase and trypsin inhibitors in wheat are actually the strong activators of innate immune response in monocytes, macrophages, and dendritic cells. And therefore, large proportion of world's population started avoiding gluten containing grains for various different reasons, including sensitivity, intolerance, and allergic reactions. So this is where whole culture of gluten-free diet actually came into being. Now, like Sudha spoke about various millets, these are various gluten-containing grains. So they are wheat, barley, and rye. Rye is not as much available in India, but wheat and barley is the grains where there is gluten present, and it has there are two major proteins. There is glutenin and there is gliadin. Glutenin is the insoluble fraction and gliadin is the soluble fraction of the protein. So now, who are individuals who are following gluten-free diets? Of course, individuals with gluten disease, non-celiac gluten sensitivity, gluten ataxia, all of these are advised to follow gluten-free diet. And it is found that gluten consumption in Crohn's disease patient leads to T-cell mediated immune response, causing villus atrophy and many clinical symptoms. Now we come to the fad of gluten-free diet and weight loss. So typically, gluten-free diet, if you look traditionally, is given in case of celiac disease. And in fact, when celiac disease patients are put on a gluten-free diet, they start gaining weight. So because their symptoms improve, there is healing of intestinal lining, and they actually start gaining weight. But there is a lot of research again to show that there is no evidence of weight loss in normal individuals who follow a gluten-free diet when they do not have celiac disease. So there is no evidence at all to prove that gluten-free diets can cause weight loss. And there is a very good paper which is talking about navigating the gluten-free bloom, and where they are speaking about that even though there are multiple health claims for gluten-free diets, there is really no published experimental evidence supporting weight loss or any health benefit to the general population by avoiding gluten. And therefore, for weight loss, if individuals are avoiding gluten, it really does not actually work. Now, in diabetes, so in type 1 diabetes and celiac disease, it is found that gluten-free diets do work. The prevalence of celiac disease and other autoimmune disease are increasing in type 1 diabetes. The prevalence of celiac disease in type 1 diabetes is about 1 to 20%. Children in type 1 diabetes may not present with typical gastrointestinal celiac disease symptoms, but rather may show failure to grow and delay in puberty. And for this reason, patients with type 1 diabetes should be screened for celiac disease at the time of diabetes diagnosis. And also, if they are, then they should be offered gluten-free diet or wheat-free diet. In type 2 diabetes, again, there does not appear to be a link in type 2 diabetes, metabolic syndrome, and development of celiac disease. Now, the most important thing, whatever is the diet, the very important thing is the price point. And if you look at it, there is a significant difference in cost between and dietary fiber content between maybe a gluten-free flour and wheat-free flour, whole wheat flour. So if you look at a whole wheat flour for 5 kgs, the price changes, and when it becomes gluten free, look at it, 640 rupees for 5 kgs of gluten free atta, and 5 kgs of a regular atta is just 220 rupees. So 3 times the cost. Even cookies, and we are not recommending that you eat cookies, but people tend to eat them. And if you're looking at a 200-gram pack of a gluten-free cookie, you'll find that the cost is much higher of 125 rupees as compared to regular biscuits, which are just for 35 rupees. So in conclusion, there is no evidence to show gluten-free diets aid in weight loss. Patients should be discouraged from following gluten-free diet without proper testing and ruling out celiac disease. For those diagnosed with celiac disease and concurrent type 1 diabetes, intensive management with the experienced dietitian is necessary if they have to go on a gluten-free diet. Thank you so much for a patient hearing, and I'll be happy to answer questions at the end. Thank you so much, Dharini ma'am.
Thank you, Shilpa, for that amazing presentation and done much before